Alright guys, welcome again here at the Apostol Dental vlog. So I will be discussing with you guys this very complex case. A case of a 57-year-old male Caucasian is actually based here in the Philippines for quite some time, and he has this very complicated case. So he went to my clinic with a chief complaint of having this a lot of problems like unsatisfied smile, cavity, gum problems. So ang dami niyang chief complaint, ang dami niyang problems actually. Perhaps the effects of the pandemic, no? I mean, it's been a while that a lot of clinics na nag-close down because of what happened for the past few years. And some of which, ito yung mga cons, mga problems after the pandemic that we have to deal with. And that is oral health. Okay? So, before siya nagpumunta dito, mas lumala according to him. And of course, thorough assessment is very important when we do this type of case. Before we can come up with a treatment plan, we have to make sure that we get all the details, such as CBCT or dental CT scan. We have to make sure that the condition of the teeth, no, the roots, will be seen in a three-dimensional image. So we have a CBCT, dental CT scan in our office here at Apostol, and easier for the patient na hindi na sila alis to get the scan. So we have everything here. We have the photography, of course. We need to make sure that we got all the details, no? Ng face, ng teeth, when the patient smiles, the details of the gums, the condition of everything. So we took all the photos. We have a photographer named Joseph. So he's the one doing the photography. So when we do also our assessment, syempre hindi lang pictures and x-ray. The most important thing is that we have to check it clinically. So pinapaupo sa chair, and the dentist and the assistant will check the case, and tinitingnan, ino-note natin ano ba yung mga problems, such as the condition of the teeth, condition of the gums, the mobility, if there's any dental diseases such as subfraction, abrasion, something like that. We have to take note of these types of problems, caries, periodontal diseases.
Dok, pag pudpud ba ang ngipin, mas sensitive ba siya?
Yes. Pag napudpod ang ngipin, and we have two types of protective barriers, layers ng ngipin. We have the enamel and we have the dentine. Pag napudpod na yung enamel, na expose yung dentine. So we have this theory called hydrodynamic theory in dentistry. Yung dentinal tubules niya, pag once napasukan yung external stimuli, like mga water, mga acid, something like that, it could cause sensitivity. Kaya pag may early signs pa lang, dapat ma-check na natin kung what's causing it. Okay? Attrition ba? Erosion ba? May problem ba sa acidic ka ba? Or something like that? Or may problem ba sa bite? So, gagawa natin ng paraan. Nung natapos na nga, kinolate namin lahat, and then we discussed it with my team. And doon, we found out that there are a lot of teeth that are subject for root canal. Okay? So before we go straight to the restoration part, which is, the reason why he went to the clinic, we have to deal with the health first. Okay? Yun yung pinaka-importante. We have to deal with the health of the teeth. That's basic. Health should be at the top priority. And not just the teeth, but also the gums. So we give the patient first to our specialists, for the periodontist, for the endodontist, to make sure that we have provided the best treatment for the patient. Okay? So hindi siya yung parang one-man team na ako lang. Ako lahat gagawa. Ako mag-root canal, ako deep scaling and polishing. So it's not what I do here. I have a pool of specialists who's helping me to come up with, a better results. Of course, we run everything. We run with the T-scan to check the bite. We get all the possible details. We get the Facebook registration. We mounted it with the adjustable articulator to get the centric relation, because this is a full mouth reconstruction, almost full mouth, because we are yet to do on implants pa. Hindi lang siya natapos, syempre. This is a very, very complex case, and it requires more from us and for the patient as well. It requires more time. So after clearing the gums, the supporting structure, after clearing the teeth and the health of the individual health of the teeth, root canal wise, my endodontist, my team cleared it, the periodontist cleared it, and they pass it to me. Syempre, Doc, pwede na ba? Pwede na ba natin i-restore? Of course, I will not decide lang. My team will help me decide sa lahat. As what I have mentioned, we are always systematic here, and we have our protocols that we follow and parameters that we should be aware of. And that is the health, the functionality, and aesthetics. This is the preparation. As you can see here, medyo ang daming issues. We did lots of build-up, root canal. After root canal, build-up again. Bio-based, biomimetic approach in restoring the old tooth. Kasi it has old restoration. Dami niyang PFMs before. Medyo nagkaroon ng problem. May leakage. So napasukan yung ngipin. Nagkaroon ng problem, root canal, gum problem, gum issues. Ang dami talaga. So we get rid of the problems, and we made sure that we are nasa tamang landas. So after the preparation, we took everything, impression, Facebook registration, and voila, this is the ceramic. We have given the patient a super white teeth as requested. We actually want to give him not crazy white. This is BL1 shade with translucency. For some, hindi talaga babagay ito because of the skin tone, because of the lips. But because of his skin tone and the profile and everything, the lips, the lip line on the maxilla is kinda tricky. That's why I allowed it. So ang daming nangyari. We did the upper restoration first, no? And simultaneous to, after cementing it, okay na. Tapos yung patient naman is continuous yung treatment niya with our periodontist just to clear out all the problems with the gums. Kasi it's really hard to maintain the gums. It's kind of habit, no? Dapat that you have to floss every day, and you have to make sure that maayos siya. Also, there's a little bit of, not like super perfect, may konting black-ish dito because of the old restoration na halos sobrang itim na sa loob. Sometimes it's really hard to conceal that. But, you know, because of the lip line, low lip line siya, so whenever the patient smiles, hindi nakikita. It's not noticeable at all. So, huwag niyo nang pansinin yun pag hindi naman siya noticeable. If it's noticeable, it's a different story. Baka bunutin na lang natin. Kasi, with this type of treatment, if you have gum problem, if you have thin biotype, if you have discolored tooth structure from the inside, there will always be a problem when it comes to concealing that discolored tooth. So as you can see here, it's really beautiful, it's functional, it's healthier as compared before, and it's flossable. The patient can floss it perfectly without any issues at all. So for the upwards, crowns, and then for the lower, it's combination of veneer and crowns and bridge. So here's the final outcome of the case. It's really beautiful. It's very white. The design, it's symmetrical to the face. Health is very important, especially when we do our restoration. Pinaulit ko palagi na health is wealth, because whatever we treat, no, lahat ng mga tinitreat namin, it will not last if it's not healthy. We cannot guarantee anything like 100% dapat magiging tatagal siya ng sobra or 10 years, 20 years. At the end of the day, we are doing our best. This is a systematic approach and very scientific. For some cases, it can last mas matagal. For some cases, hindi. Because of the actual problem. Kasi kung mag-start tayo sa worst, syempre the chance of the longevity of the restoration, yun, nagiging questionable siya. The restoration material, hindi. Pero ang nagiging questionable doon is yung tooth structure niya mismo. Although we have implemented a lot of sciences like biomimetic approach when it comes to build-ups, restoration, and even with our perio treatment and the gum treatment and the endodontics, it's always at par with the world standard. So we are confident naman na we are giving what's best. And this is aesthetic dentistry, not just beauty, but also function and health. A lot of cases, no, will be tackling. We will be tackling more cases in the future. So watch out. There are a lot of cases that's available that we are going to share it with you guys. The same thing, different case, different scenario. Hopefully, some of you can relate with the case, no? Na some patients kasi they thought their case is worse na. So may mas worse pa po na nagagawa ng paraan. But sometimes, hindi na. Pero nagagawan pa rin ng paraan, but different na lang yung treatment. So it has something to do with the current state of your teeth. So we will be giving you more cases for you to relate on. So let's see. Thank you guys, and I'll see you soon in my next vlog.